So before we dive in, I would like to do just a quick set of intros just of the CLHO and the Office of Rural Health folks, just so you know who we are and can put names to faces and know who to reach out to. I will go ahead and start. My name is Laura Daly. I use she, her pronouns, and I am the program manager with the Oregon Coalition of Local Health Officials, often referred to as CLHO. And I am very excited to be with all of you today. I believe that I was able to meet most of you in the late winter, early spring when we were applying for this opportunity, but I'm excited to get to know all of you more. And I'll pass it off to Sarah and then Madison.
Good afternoon, everyone. Sarah Lochner, the Executive Director of CLHO, and I believe that I was instrumental in recruiting all of you to join this crazy grant endeavor that we have undertaken. So thank you for being here, and look forward to working with all of you. And I will let Madison introduce herself.
Hey everyone, I'm possibly the newest face in this group. My name is Madison Reithman. I am the newly onboarded grant manager for this project. I am working with CLHO, and now we'll be working with all of you to kind of develop this project from start now to finish. So looking forward to getting to talk with you all more about this over the next couple of years.
And then I'll go to Stefa and Sarah Anderson. I didn't warn the two of you ahead of time that we were doing intros, but if you would like to introduce yourself, you certainly can.
I was going to let Sarah go first. Sarah, go ahead.
All right, thank you, Stefa. Hi, everyone. I'm Sarah Anderson. I'm the Director of Field Services at the Oregon Office of Rural Health. And we're the fiscal agent for the grant, which means that we submitted the grant under our name, and then we're subcontracting with CLHO, who's subcontracting with the partner, the educational partners, et cetera, for the grants. So really excited to be here. I see some familiar faces and names. And also want to mention that on the phone is our interim director, Bob Dumig. He's the phone person, at least on the bottom of my screen. Bob is really excited to be here as well. I don't know if he's on mute or not. Bob, do you want to introduce yourself really quickly?
Yeah, hi, I'm Bob Dumig, the Interim Director for the Office of Rural Health, and I'm on the road, so I'm going to keep myself muted, but glad to be here.
Awesome. Hi, everyone. It's nice to meet you all. I'm Stefa Dragoon. I use she or they pronouns. I'm the Rural Population Health Program Manager with the Oregon Office of Rural Health. So I work with Sarah Anderson and Bob Dumig over at ORH. And I will be providing some administrative support on our side of things, really here to support Madison and the CLHO team for this project. It's nice to meet you all.
Perfect. Thank you all. So for this initial meeting, we wanted to make sure that we did not take up too much of your time because we know you are all very busy, but we still wanted to provide enough time to talk about the project, refresh everyone, and answer questions. So for today, we aren't going to be spending a great deal of time on introductions. We want to do that at a later time when we have the networks in each county going. But we do always like to do little check-ins before we just dive in to the material. And so we have a quick couple of check-in questions for you today. And the first one is, which dog are you today? And you will see on your screen all of these different options. If you know anything about the CLHO folks, you know that we love dogs, and we will come up with any excuse to put in a picture of a dog into all materials. So what we are going to be doing is using the annotate feature, and I will walk you through that. Let me pull up the directions here for those of you who like to read. Okay, in the chat, there are some directions, and what we will be doing, if you, here we go, there we go. If you go to where you see the little green rectangle that says you are viewing Laura Daly's screen, it's usually at the top of your screen. You can click on that. There's a little arrow that says view options and go to annotate. And then if you go to the toolbar that pops up on the left side, a few in from that, you'll see stamp. Go ahead and select whichever stamp you would like to use. There's a heart, there's a star, there's an X, it's a check mark, whichever you would like. And then just go ahead and put on the screen, click on the screen which dog you are. What is your mood today? And if you make a mistake and put a stamp in the wrong place, you can hit the little trash can icon to clear your selection. Okay, I'm seeing people. I'm seeing a lot of people select the little hurtling dog. That's good. That's high energy. Thank you, Jocelyn. It doesn't always feel like it. It feels clunky every time. Okay, I'm seeing it slow down. So I would love to ask one or two people, where did you put your stamp and why today? What's going on for this check-in? Sarah Lochner, I think I saw you put a heart on the dog hiding under the blankets.
Well, I was trying to close out my chat box, and so I accidentally voted twice. But I am kind of a number one as well. I think I would rather be in bed, but I feel like I'm off and running. So I actually did originally vote for dog 6.
Anybody else care to unmute and just give us a little check-in and say what you're feeling today and why?
Okay, someone asked who's number 3, and I'll own up to that. I've been traveling for conferences for about a week now, and I've just been eating a lot of really big meals. So I feel like that is why I chose number 3.
That's valid. I think I didn't actually put a stamp anywhere, but my house right now is number 5 because I am dog sitting, and my dog and the dog that I'm sitting tend to wrestle a lot and drink a lot of water. And then my dog is not great about controlling her bladder just because of a whole bunch of issues. So there's a lot of accidents everywhere today. So that's what's going on here. Thank you, everyone. That is, we love to do check-ins just to see how folks are feeling. So we're going to use the annotate feature again and go on to, oh, I'm gonna clear it though, so we're not super confused. There we go. So we are going to do another quick little check-in. We would love to know, where are folks who are on the call today based? And so we have a little map of Oregon here today. If you exited out of annotate, here are the instructions again to get back into it. And yeah, if you can just put a little check mark where you are calling in from today, or where you are based, I guess would be a better way. See in Klamath, see Lane, see Malheur, Harney. And then I just realized, Megan and Betty, I saw you both jump on. I'm sorry that I don't have Washington on here.
That's okay.
And Laura, I think Harney might have been an accidental annotation before you actually folks got oriented here, but that's just my.
That would make sense. Seeing a couple of Multnomas. I'm seeing Union. See, we got some good Central Oregon representation. We got Wheeler, Jefferson, Deschutes, and Crook. I think I see it slowing down. I don't see a ton more people putting stamps down. Great, thank you. So I don't think we have anyone from North Central here today or from Wasco here today. And we're partly recording this meeting so we can take notes and make sure that all partners are aware of everything that's going on and are in the loop as we move forward. Oh, Shelby, thank you. Yes. Shelby from Wheeler County is here, but her annotation does not work. Okay, well, perfect. Thank you everyone for doing that little check-in with us. And then I am actually going to pass it over to, I believe, Sarah next. Is that right?
Yes, Sarah L. That is me.
Okay.
We have multiple Sarahs with us today, as usual. Thank you everyone for being here. So just quick reminder, and as you'll recall, so there are really two main projects within this grant. One is we are going to work with Treasure Valley Community College in Malheur County to create a community paramedicine program. And then the rest of the projects are going to be focused on community health worker training and employment. So the idea is to recruit these folks, get them trained or cross-trained in various other skills, and then place them with employers. And hopefully a lot of you on here are looking for ways to incorporate community health workers into the work that you do, because they are a wonderful bridge to help creating health equity in many communities. With that, I'm going to actually let Madison do a more in-depth reminder of what this grant program is. But before we do that, I want to just tell you how awesome Madison is and why we hired her. So Madison has a bachelor's degree in natural and chemical sciences from Xavier University and a master's in public health and epidemiology from St. Louis University. And prior to joining the CLHO team, she worked as an epidemiologist in Clark County, Washington, which is where Vancouver is, and also helped out Reed College here in Portland during the early days of COVID, when everyone was trying to figure out, what to do, how to deal with students on campus, what policies to put in place, and that sort of thing. And she has worked on a variety of health-focused projects, including infectious disease outbreak response, community health evaluation, wildfire impact assessment, and of course, health equity. Born and raised in a small rural community in Northwest Idaho, Ohio. And she's been in Portland for the last few years, but clearly still has her small town values and understanding of small communities. And so bringing her knowledge of public health, her work in higher education, and her small town background all together to help us get this project off the ground and hopefully make it ultra successful. So she also has an adorable dog named Juniper, which is almost a requirement to be part of the CLHO team. You have to have a dog. So we appreciate all the skills that she is bringing to this endeavor, and she's super friendly and super organized. So I think you all are really going to enjoy working with her. And with that, I'll turn it over to Madison to go a little bit more in detail about the grant project and what you can expect.
Fabulous. Thanks so much, Laura. Thanks for sharing your screen again and throwing up a few slides to kind of help center what I'll talk about. Apologies if some of this is repeat for y'all, but I figured it would be good to just kind of start at the beginning, walk through kind of what this project is going to look like, and then go into some more detail about our more immediate goals and how we're going to move forward. So as was mentioned by Laura and Sarah, this Healthy Rural Oregon project is a 3-year HRSA grant funded project, which is really aimed at improving the homegrown kind of boots on the ground public health and healthcare workforce in the rural parts of the state. Particularly for our project, we are focusing on the development and deployment of community health workers, and if you're in Malheur County, paramedicine providers. So the foundation of this project is really in building those community networks to meet these project aims, which really, like I mentioned, were bolster that public health and healthcare workforce in rural Oregon, to improve the access to services through this larger community health worker or community paramedic workforce. In addition, we're hoping on the other side of this that it supports local health organizations in their employment demands. So we know that there's a lot of gaps that employers have in the way that they're providing services. And we're hoping that by building up a more robust community health worker and community paramedic workforce, they can also fill some of those other gaps through cross-training. And then finally, we want to build this long-term health sector education to workforce pipeline. So by boosting the educational programming and training resources we have developed in our rural communities, we can then make this a really sustainable long-term pipeline, taking interested community paramedics or community health workers, getting them trained for the needs in the community, and then having them, build a good connection into the workforce. So Laura, if you don't mind, flip into the next slide for me. To kind of just lay it all out in a timeline like this, there's really 3 big phases that I see here, right? Starting with participant recruitment, taking those participants into education and training programs, and then placing those participants in employment and long-term development things. And that's really where this whole network of people that we have on this call today and organizations that we have represented by this program, that's where it really comes in. So, I think everyone pretty much will be involved and excited to be involved in the participant recruitment phase. I know that there's a lot of you who probably already have ideas of participants or know where to look if we're searching for people to participate in this program. So we want to identify either current or aspiring community health workers and community paramedics and eliminate any barriers to them participating in this program and moving forward in this kind of start to finish pipeline. Then once we have them enrolled in the program, we want to provide them with the appropriate education and training. So that means not only enrolling them in the programs, but also bolstering those programs, working together to develop curriculum, to look at cross-training opportunities, to take our existing curriculum and boost it with other existing, maybe online programs or other training opportunities, and then help these to eliminate some barriers for participants in supporting that completion of a program. We know that that can be a barrier for people sometimes in actually starting and finishing a program that can take months or even years. And so identifying and removing some of those barriers to completion is another important piece. And so once we're there, then it's about partnering them up with employment organizations. So hiring and onboarding them into our health sector employers and other partners, and applying, like I mentioned, those cross-training opportunities. So once we have somebody lined up with a position that's a good fit with one of our employers, we can then talk about what other needs there are to be filled within that organization and how these new hires can be cross-trained to slot in and help support the organization's workforce as a whole. Then you'll see down there at the bottom that kind of partner and participant support spans the whole program, right? And so that's where organizations like us and like the Office of Rural Health and like Northwest Center for Public Health Practice come in. So we're going to be here from start to finish to do all of those less fun, potentially logistical things, right? So supporting you and identifying what needs we have in the program, managing the funding and the grant deliverables back to HRSA, developing resources and sharing those resources with all of you and with our participants, and really doing a lot of that network building as well. So we've got kind of the whole network or many of our network representatives on this call today. But going forward, this program is a lot of smaller counties doing kind of smaller projects, right? So building those networks within the county or the community will also be a step that we take going forward starting now. So Laura, if you want to give me one more, perfect. So I want to dive in just a little bit about some of our short-term goals with the program. So one of the first things we're looking to do is hire a Central Oregon workforce navigator. And I know we've talked with a few of you on this call about our recruitment for this position. The position is currently open. We are accepting applicants and excited to see some of those come in. This position will be a project representative based in Central Oregon and will be responsible for coordinating the participants that are funded by the Community Health Worker Program in Central Oregon, basically assisting them through the education, training, and job placement process. That person, the navigator, will work closely with me to make sure that we have our project goals kind of aligned, but this person will be based likely in Jefferson or Deschutes County, really to be kind of a direct in the community resource for our Central Oregon participants. This person will also work with our education and employment partners to make sure that those partners are well supported. So like I said, we are recruiting for that position now. We have a position description posted on our website and available as kind of a handout, so we can share. I think we actually shared that in the meeting invite, but we can also follow up afterwards and share that with you and encourage you to share it with your networks. If you, people who would be interested in this position or potentially good for it, please pass it along. We are excitedly looking for applicants now, and we'll keep the position open until it is filled. Next on top of that is kind of just finalizing those training and educational offerings so that when we do have people enrolled in the program, we have a great place, to send them. And a lot of our community college and educational partners on this call have already been hard at work identifying and bolstering that curriculum. And that's something that I'm going to start coming in and helping, assisting you with as well. We want educational partners to have the support that they need to build up that additional programming, as well as supporting employers with the needs of developing onboarding resources, cross-training materials, and things like that. While this is all going on, we are also wanting to look for and identify participants for this program. So over the 3-year grant period, we are hoping to recruit and train 27 new community health workers and boost or cross-train an additional 100 existing community health workers. For the community paramedics program, we're looking to recruit 40 new community paramedic program enrollees, so like EMT, EMS, as well as cross-train at least 24 existing EMT or EMS providers into the community paramedic program. So this is a pretty big increase into these programs and into the workforce. So we are going to be, enrolling participants probably not all at once, and we'll probably be steady throughout this program. But as you identify people that you think would be good for this program, we would love to bring them into the fold and engage them and streamline some of those processes for getting them, into the programs. And then lastly, building the network partnerships and communications that we're starting here today. Those will only grow over the next 3 years. And we really want to put the pieces in place to ensure this work will continue and grow beyond the 3 years after this grant period is over. Partnership building will really be key in that, as well as identifying and addressing any barriers to sustainability early. So like I mentioned, we're going to be working on both a large kind of statewide scale, but also in our smaller community clusters, in building those networks and identifying some of those barriers to keeping these programs going long term. One other thing I just wanted to touch on before I launch into or open the floor up to some questions is that I see this as kind of one project, and there's a lot to learn and model from each other, but also I just want to make it clear that I see that you are all individual projects and programs with different needs and who may be in different places at different times within the program. And it's important to me to treat that as such. So over the next, several months, I'm going to be reaching out to all of you individually, trying to kind of get together some of those more local networks and see where you are in this process to kind of help support the development of the short and long-term project goals. So with that, I wanted to kind of open up the floor to any questions we have about the project at this point. Sarah and Laura and our Office of Rural Health folks I know are here to kind of back me up, seeing as I'm on day 6 of the job, but would be happy to answer some questions about the program or just where y'all are at with things.
And while we're waiting, oh, Gesundheit. Madison. While we're waiting for questions to come in, I'm noticing several familiar names from the registration list for the Oregon Rural Health Conference this week in Sun River. Madison, Sarah, Laura, Steffa, and myself, and Bob, if he's still on, are all going to be there. So please feel free to come and find us, and we'll try to find you as well to say hi.
Yes, please do. And actually from the conference, I kind of had a plan to send out emails if I'm going to be like holding court in some of the common areas during some of the breaks. And so if anybody's going to be there, I would love to take the opportunity to meet you, grab coffee, and just talk about the project more.
Yeah, and I just want to throw in, we're using the Whova app, and that's a really great way to coordinate those meet and greets too. And you can direct message and all that stuff as well.
Yay, Katie Plum will be there. I know Sarah Barron will be there. I don't know if Michael Baker will be there because he is presenting. Jennifer Little will be there. Albert will be there. Yay. So be a great opportunity to connect with all of you.
I've got a boring question.
Go for it.
Sorry, what is the status of like contracts? I don't think I've seen like subcontracts yet for our college, just so that we can actually like start invoicing and all that stuff and really get started.
Yes, so it is on an invoice basis. So you invoice Madison and or me, and then we will send the invoice to Office of Rural Health, who will then reimburse us or pay us to pay that invoice. So that is definitely one thing we want to get started, especially for you education folks. So looking at the time, it's only 2:30 and we have an hour slated for this meeting. If we are able to end early, it would be wonderful if we could have the education partners stay on the call for a few minutes to kind of give us the rundown of what you need to get started. Any other questions?
This is Lieutenant Commander Joseph Tibai for the Klamath Tribal Health and Family Services. So am I understanding that this grant is to hire, we're trying to find community members? We're not trying to hire from, we're not trying to train from within?
We can do both. So the idea is to recruit some new community health workers to give them the base training. And then in addition to that, those new health workers can get some cross training paid for. We can also utilize the community health workers we already have on staff if some cross training would be helpful for them. So it's both and.
Okay, thank you.
Yep. What does cross training look like? So we have a menu of options available. We are looking at, and Madison, I'll have you jump in to see if I miss anything. We're looking at health and healthcare interpretation, medical assistant training. Sarah Barron at Central Oregon Community College is going to develop a series of continuing education modules that will be on a, there'll be short little blocks of training that can, be on how to sign people up for OHP or OHP billing or what else? I don't have it in front of me. So if anyone else wants to jump in and help me complete the list here.
I think I can jump in because I don't know them all off the top of my head, but there's definitely a fine line because we don't want to go out of the scope of work of what a community health worker does.
Right.
But them being very familiar with some of different aspects of health informational technology things, and so it would be very much continuing education units, and it would be online, kind of self-paced or hybrid approach. And in many ways, just I got distracted by the chat, sorry. Really focused in on continuing education units. So maybe additional information on oral health, for example. They already have to do their CEUs on that, but maybe a little bit more in depth on CHWs and oral health, or documentation, and doing SOAP notes, or anything that would be applicable to the workforce. And I wouldn't be doing this alone. I would definitely be getting in with the workforce and working very closely in the development of that, if that hopefully answers some questions.
Yes, and we also have, so Benton County provides a very in-depth training as well, that is core community health worker training with a clinical navigation component as the cross training. So we do have some money set aside for a cohort of folks to go through that. We also have peer support specialist training available as the cross training component, in partnership with Klamath Basin Behavioral Health. And I think that about covers it, but I will say, if you all have a need in your clinic or public health settings that you feel it would be helpful for your community health worker to have, I think, and I'll look at Sarah Anderson for confirmation on this, that we could potentially provide that if it was, if it's outside of these specific training pieces, but it would be helpful in a rural clinic setting. I think there's the potential for that.
Yeah, absolutely. I'm thinking of things like, nutrition, kind of a module, or food security and those sorts of things. If they're not part of the core training, we can add those on.
Sarah, do you see Michael Baker's comment and Susan's comment too? It really depends on what the community health needs are for that area.
Exactly.
And that's part of the reason why the workforce navigator for the rural areas in Central Oregon, each area will have different needs. And I think really understanding what those needs are will inform what the cross training development will be for that area.
Exactly. So yeah, that is exactly what Madison meant by meeting you where you're at and figuring out what you need and what would be helpful for your area. So absolutely. Susan, will there be a survey? What do you mean? Can you elaborate? For needs and training. So I think Madison will rather than do just like an email survey, Madison, I'll let you take this one. How do you want to approach it? Yeah.
So that's kind of going back to where I realized that pretty much all of our partners are going to be in different places with the kind of trainings that they'll need and stuff. So rather than doing kind of a full network, survey, I would rather talk with each county or each organization individually and kind of identify what those needs are, and then we can kind of tailor them a little more individually.
Joseph asked, do we have a limit on how many people we can get trained? Well, we are limited by the budget and kind of by our total numbers of folks that we said we would train. So if we are able to largely, if we are able to hit the goals that we said we would hit, and if we have some flexibility in our budget, we could potentially go beyond that. But there is other than being limited by the budget, There's no specific limit set per county or per organization. And Jocelyn asks, is there a timeline of activities yet? I'll turn that one over to Madison.
Yeah, so that's kind of what one of my first priorities of building. And once again, I think every county will kind of be on their own specific timeline, just based on where they're at and what kind of, where they need more support in the start to finish kind of pipeline. But overall, we're on this 3-year grant timeline. So everything should fit within that 3 years. But if, one county may be in the place where they need to recruit a bunch of new people into the program and start that from scratch, that part is going to take a little longer than some other organizations might already have their pool of people recruited and ready to go, but may need more time in the cross training or the onboarding into employment end of things. So when we kind of start talking individually, I would like to make individual timelines kind of for each group so that we can kind of keep on track for where everybody is in the project. Great. There's any other questions, we have time to take them now, or I think I saw my contact information put in the chat there. Thanks, Laura. Please shoot me an email or a phone call or a text message if you want to set up a time to chat. If I don't hear from you, I'll be connecting with you directly, probably in the next week or two, because I would love to kind of get these conversations going about moving forward with the project. Sarah, Laura, anything more to add on that before we jump into shared governance?
I don't have anything. Take it away.
Great. Laura, do you want to throw my slide back up? Awesome. Okay, so I wanted to spend just kind of the next maybe 10, 15 minutes. Actually, we have up to 20 minutes to just talk a little bit about how we're going to move forward with those connections. So I talked a lot about, connecting with all of you to, make individual plans and meetings and things like that. So wanted to just kind of hear from the group any input or answers to some of these considerations. First, are the right people from your organization involved? Are you the person we should be contacting, or just having in mind who should be involved from your group on this project? And then what is the best mode of communication for you? How would you like to receive updates and how frequently? We can do that. I think there will be a variety of that, of individual communications with me and with the other grant partners, as well as like wider, entire network or entire project updates. So curious if anybody has thoughts about the best way to continue to get updates, whether it's more meetings like this, whether it's, periodic email newsletter kind of communications, what works best for you. And then the last bullet here is more for your own brainstorming at this point, but what are your early needs? As we've talked about this program, where are you at in this process, and where could you use the most support to kind of get things off the ground? That's where I would like to start our conversations when we start kind of diving into that. And so just starting to brainstorm that over the next week or two could be really helpful in going forward. So I don't know if anybody has any thoughts on how they would like to continue engagement with this project, or if any of our programmatic folks, Laura or Sarah, etc., have thoughts on how you would prefer to do that.
Well, we're certainly open to suggestions. I think I sort of had in my mind, like maybe we'd meet once a month or once a quarter and share updates across the sectors. But I have no idea what you all would prefer. And, given that we are spread across the state, I think meeting over Zoom makes a lot of sense. And then Madison will make trips out to visit each one of you in your local communities as it makes sense for the project. So But as a entire group, that's what we're trying to figure out moving forward, you know, how often you feel would be helpful for this group to meet so that we can move the project forward.
I would say quarterly at most, but it depends on what is needed. Kind of play it by ear. If you don't have anything that needs to be said, then you could probably skip a meeting. But yeah, monthly is probably a little bit too much, I would think.
I typed in my thoughts, and maybe after you get your head around the grant deliverables with the timeline, and then you know, monthly, like you get a core group of people who are like you have your meetings quarterly of all the kind of key stakeholders, and then monthly with the core team that kind of push the rollout of the grant to make sure the systems are in place, if that makes sense. And I think once you have those timeline of activities and deliverables and people and email the group, then you could set up your meetings around that. Kind of like, I sound so Gen X, but you know, when you have the meeting, it's like a purpose for the meeting kind of thing, with those grant deliverables and timelines kind of helping you guide the conversation, which I'm sure that's what we're planning on doing anyway. Yeah. Liberty's saying I like quarterly with individual check-ins. So I'm hearing quarterly. Monthly with probably the rollout of, like, you know, getting things going for individuals and groups of people. Quarterly for the whole group, I'm seeing.
Yeah, and I think, you know, from an organizational or on a smaller scale, we will definitely be checking in at least monthly, probably even more frequently than that. And what I'm hoping is to set up, you know, an easy way for all of you to be able to reach me with questions or process, you know, things as needed, so that we don't have to wait for a check-in if you have something coming up or something that's going on. You know, we can stay in close communication that way. And then, yeah, as Sarah was kind of talking about, for these larger group meetings, monthly or quarterly, I like having kind of an idea of sharing kind of how the entire project is going across the state, so that you know, folks in one county or in one project can kind of understand how the other projects are going as well. Okay. Thanks, y'all who've been putting things in the chat for us. This is really helpful. So why don't I propose that we'll start with quarterly, all kind of partner meetings. We can record those meetings and we can share out our minutes and our agendas and our slides afterwards, just so that folks who aren't able to make every quarterly meeting can stay up on those. And then as we get more of kind of the timelines and deliverables and things together, we can include those in those slides, and then those can kind of serve as quarterly reports for all of you, just kind of updates on how the project is going. That sound like a good place to start? Awesome. Okay. Well, are there any questions on kind of our communications or our shared governance that we should talk about now? Awesome.
This is Laura. I just want to flag that meeting quarterly would mean that our next meeting is in January. I just want to check in and make sure that works for everyone. And then in the meantime, Madison will be doing outreach individually. Would something like a, you know, bi-weekly or monthly email update be welcome and helpful? I can't see everyone, so I can't see if people are nodding or not. Perfect. Thank you, everyone, putting it in the chat.
Okay, great.
Okay, perfect. Thank you, everyone.
All right. Sarah, anything else to add at this point?
No, I was just saying that was easy. I was going to ask you if you have
That's easy.
anything else you need from the group.
I don't. Like I said, I'll be at Oregon Rural Health this week, so we'll hope to connect with a lot of you then. And I would assume that many of you will start to see emails coming through from me with more of a direct introduction and to set up a time to kind of get started and start chatting about some of this. So.
And I'll just say that we will be connecting with Sarah Barron for breakfast on Friday at the Rural Health Conference. So if you all want to join us, you are welcome to. We'll be near the food table from 8 to 9 a.m. because that's where I like to hang out, is near the food. If any final parting words, or we can let most of you go and just have the educational partners maybe stay on for a few minutes if that works. Okay, well, thanks everyone for joining us. We appreciate your time and look forward to doing some great things together. Let's see. Awesome. Okay, so see, Jeff, where are you from? Or is that Mike from Jefferson County?
No, this is actually Jeff. I'm actually from Idaho, which I'm currently a community paramedic, and I'm going to be helping out TVCC.
Awesome. Great. Glad to have you, Jeff. Well, Madison, so we've got TVCC here, Jeff and Cheryl and Andrea, and we might do a quick check-in with them, and then we can focus on community health workers. Does that sound like a good plan?
Yeah, I think that sounds great. And I think really just kind of getting a better understanding of where you are all at in the process of bringing people on will give us a little bit of an idea of how to structure our timelines as far as invoicing and kind of the financial side of things.